Hello friends, welcome back to our channel Vibrance and Vitality. This is your host and host Mukta Sharma, and today we are going to explore a very informational topic, smart quality tool. Smart quality tool for transforming healthcare to improve patient care. Do you know, my friends, what is smart quality tool? A quality tool used to set and achieve goals, which is specific, measurable, achievable, relevant, and time bound goals. SMART is an acronym that stands for a specific, measurable, achievable or attainable, relevant, and time bound. So, specific, under the specific component of the quality tool clearly defines what needs to be achieved. Under measurable, we will know the quantifies goals, making progress to achieve the goals. By how much we can know about the measurable component of quality tool. Then the third one is achievable, or we can say the attainable. So ensures goal is realistic and attainable. So how we can set the goal will come under the achievable component of the smart quality tool. The fourth one is R, relevant. Relevant means why? Align with overall attainable principle and priorities. Number fifth is T, time bound. Set a specific deadline or time frame for achievements. So, do you know, by setting such goals, we can create a clear and effective plan to achieve our objectives. Now, we will explain one by one, like under specific component of the smart quality tool. We will take one example. So, our goal for the healthcare setup. Here our goal will be reduce hospital readmission rate for post-operative patients. So what is the real scenario? Take one scene, like generally the patient got discharged after the post-operative surgeries, and high 30-day readmission rates for post-operative patients lead to poor outcomes and increased hospital costs. So under smart quality tools, we use these tools and we can reduce the cost of the hospital. We can reduce the use of the logistics. We can reduce use of the resources. So how we will use in our hospital setups? So under specific component of smart quality tool, we will set the goal. What will be the goal? The goal will be reduce 30-day hospital readmission rate for patients discharged with the post-operative surgery. So make the goal specific with an end point. Fuzzy goals can cause confusion. So the goal should be specific. That's why S stands for specific. The next is M. M for measurable. So under measurable component of smart quality tool, we set the goal to decrease readmission rate from 18% to 12%. So earlier the readmission rate was 18%. So now our measurable component will be 18 to 12%. So the progress of the goal should be measurable. In addition, the end results can be measured too. So here our measurable goal is 18 to 12%. We have to reduce the readmission rate. Now the third point is achievable, or we can say the attainable. So both are same, achievable or attainable. So under achievable component of the smart quality tool, we will implement targeted discharge planning. So we have already discharge planning, and we have the follow up calls. So we call the patients within 7 days in our OPD, and that is what happening in our department as well. And we will educate the patients regarding the medications, the doses of the medications, the durations of the medications, and the follow up. So in which OPD they will come, and when is our OPD, and they will attend the OPD in the OPD, that is follow up calls. So in the achievable component of the smart quality tool, make the goal achievable with your available resources. Do not overextend without a plan. So everything should be planned. We have to plan for the discharge, for the follow up, and for the patient education. So if we will do that, then definitely our readmission rate will be reduced. Then the fourth point is relevant. So under the relevant or realistic component of the smart quality tool, we will align with the hospital goals. We will align our goal with the hospital goals to improve quality of care and reduce avoidable admissions. So under realistic and relevant goal, we examine the forces around you. We examine our surroundings, our available resources, and can the goal happen within your day-to-day environment. So we will align. Relevant means we will align the goals with our hospital goals and to improve the quality care of the patients. And in this way we can reduce the avoidable admission. Then our fifth point is time bound. So what is time bound? Time bound is set a specific deadline or time frame for the achievement, for the goal achievement. So under the time bound component of the smart quality tool, set an end date, set an stipulated time frame and work to that date. If you keep the date open, then most likely you will push them out. Now for our goal, we will set the goal for the 6 months. So achieve this reduction within 6 months from the start of the intervention. So we already set the time frame of 6 months, and within the 6 months we have to decrease the readmission rate from the 18% to 12%. So overall, this quality tool SMART, that means specific, measurable, achievable, relevant and time bound. By setting such goals, we can create a clear and effective plan to achieve our objectives. So as SMART goal in healthcare helps set clear, focused and achievable objectives to improve patient care, and not only the patient care, moreover staff performance and system efficiency. In this way, we can reduce the infection rate of the patients, we can reduce the hospital staying duration, we can reduce the nosocomial infection, hospital acquired infection, we can reduce the use of the resources, we can reduce the use of the logistics, and we can improve patient care, staff performance, and system efficiency. So, dear audience, I hope this information will be helpful for you, for your concerned department to deliver and discharge your duties and performance with great efficiency, and it can help for the better and quality patient's care, and in this way we can reduce the readmission of the patients, we can reduce the infection rate, and we can give the conducive atmosphere to the patients for their health and well-being. Thank you, and thank you all. Have a great day.